Factsverse presents 15 Creepy Vintage Medical Photos. Number 15. This photo was taken around 1937 and shows children lying in an iron lung. Also called a negative pressure ventilator, the iron lung allowed people to breathe when normal muscle control was lost or breathing was more effort than a person was able to put forth. During the polio outbreaks in the early to mid-1900s, hospital wards were filled with iron lungs, entire wards of them, assisting those who had contracted polio. These were mainly used for children, the most susceptible demographic to contract polio, although largely this method of ventilation has been eradicated. Number 14. This photo demonstrates self-suspension, a method of scoliosis treatment developed by leading American orthopedist Louis Cyr in the 1800s. Self-suspension involved binding the patient and hanging them by their wrists to straighten the spine, while it could be bound in plaster bandage to cure scoliosis. Number 13. Rickets is a disease caused by a deficiency in vitamin B and calcium, in which young children suffer from dry, spongy, brittle bones and are often deformed. This photo, taken in 1925 at the Chicago Orphan Asylum, shows a lady tanning two babies to offset winter rickets. This horrifying medical treatment essentially involved tanning babies, much like tanning beds today, to try to prevent or reduce the deficiencies. Number 12. This was a typical U.S. Civil War surgeon's kit and would be horrifying in today's medical practice. Infection was common then, and disease and infection killed more soldiers than enemy bullets. A typical medical kit contained a surgical scalpel, straight forceps for removing bullets, an amputation saw, scissors used for bandages and flesh equally, probes for locating foreign objects, tenaculium used for holding body parts during surgery, tourniquets used to staunch bleeding during amputations, bone brush to remove bone saw dust post-amputation, and an amputating knife for soft tissue during amputations. Number 11. In the early 20th century, hydrotherapy was common. Patients being treated for insanity would often be wrapped in wet sheets for anywhere from hours to days to help them relax and become less combative. Number 10. Dr. Clark's spinal apparatus was supposed to straighten the spine, but was vaguely horrifying. The patient's head was suspended by a chin strap, and the contraption made the patient largely immobile, but was supposed to pull and straighten the spine. Number 9. Injured and disabled people in the early 20th century were considered invalids. Hence the name of this device was invalid cart, although it served essentially the same function as a modern wheelchair. Number 8. Anyone who has donated blood recently is familiar with the plastic blood bags now used, which are infinitely more sterile, particularly because they are disposable. As recently as the late 70s, though, medical professionals were still using glass bottles suspended upside down as a vehicle for blood transfusions. Number 7. In 18th century Italy, midwives and medical students used an obstetric phantom shown here. It is almost life-sized and shows how birth takes place, including abnormal positions and complications, allowing students to become more practiced in the art of childbirth. Since using instruments to intervene if complications arose was very rare, students needed all the practice they could get. Number 6. The Fukushima disaster is still producing tremendous fallout, including radioactive water shown here that is demonstrating as much as 70 times the amount of radioactivity considered normal. Even the rainwater is radioactive in this area. Number 5. Prosthetics were remarkably advanced for the time. This photo was taken in the late 19th century. Many prosthetics, typically made of wood, were even jointed to allow the amputee greater mobility, although there was still stigma associated with prosthetics and amputation. Number 4. Just like modern OBGYNs have tables and stirrups, in the 1800s, birthing chairs were used to assist with childbirth. The strangest part of these birthing chairs' history is that instead of being considered medical equipment, these were actually heirlooms passed down through generations. Number 3. Around the mid-19th century, ether became a popular anesthetic to knock patients out before surgery or amputations. Ether was a commonly general anesthetic due to its ability to render the patient unconscious and its narcotic properties. It has been known to cause dependence, but compared to being conscious for a leg amputation, it is a mild trade-off. Number 2. Shown here is Edward Mordache, a 19th century heir to an English peerage who was born with an extra face on the back of his head. The second face could not eat or speak out loud, but it was known to smile and sneer while Mordache was weeping. He begged doctors to remove the demon face after claiming that it would whisper to him at night, but no doctor would dare to attempt the procedure. Because of this second face, he committed suicide at the age of 23. It never spoke to any witnesses, but the lips constantly moved, and Mordache claimed that it spoke to him, telling him things one would only speak of in hell. Number 1. Here we have Russian surgeon Leonid Rogozov, who served as the only surgeon on his particular Antarctic expedition. After suffering from appendicitis, he courageously performed surgery on himself on May 1, 1961. With the help of a driver and meteorologist who held a mirror and provided him his surgical instruments, Dr. Rogozov used Novocaine as a local anesthesia and proceeded to make a 10 to 12 centimeter incision into his own abdominal wall. About 30 to 40 minutes after the start of the procedure, the doctor started suffering from weakness and nausea and therefore had to repeatedly take short rest breaks. Miraculously, he managed to finish his self-surgery in about 2 hours and made a full recovery within 2 weeks. Later that year, he was awarded the Order of the Red Banner of Labor. Subscribe for more.